Chapter 12 is about defining psychological disorders. So we're going to talk about abnormal psychology. So it's just the application of the psychological sciences to understanding and treating mental disorders. Now, psychological disorder is defined this way. It's an ongoing dysfunctional pattern of thought, emotion, and behavior that causes significant distress that is considered deviant in that person's culture or society. A couple of things that you need to be aware of. It has to be ongoing. It has to be dysfunctional. It has to cause significant distress and then be considered deviant in that person's culture or society. So those are those four key parts of that definition you need to be aware of for it to be a disorder. Now, in the early chapters, we talked about psychology looking at the lower, middle, and higher levels of a symptom or a disorder. So that lower level was the biological level. That coincides with the biopsychosocial model of illness that we're going to look at in chapters 12 and 13. So the lower level was that biological level where they're treated, for example, with depression, they're treated with medication. That middle level was the individual level or the interpersonal level. In this case, it's the psychological level. It's the individual's thought and behavior patterns. And the social is the social and cultural, the circumstances. What happened, what changed in this person's life to cause this change in their individual thought and behavior pattern. Okay? So the biopsychosocial model of illness, we're going to use that again in chapter 13 as the method for determining treatment, ties into those lower, middle, and higher levels of psychology that we talked about early on. Something else that's very important to keep in mind when we're talking about mental illness is the concept of comorbidity. Comorbidity simply states that where one mental illness is present, generally others are present. So a lot of times people will receive 2 or 3 diagnoses. Okay, so let's take a medical example. Someone's diagnosed with type 2 diabetes. There's a good chance that they're also going to be overweight, diagnosed with that. That generally leads to high blood pressure, so there's a good chance they'll be diagnosed with that. Maybe it's because of diet, so high cholesterol might be an additional diagnosis. All of those things work together, so you change your lifestyle to treat one, and you generally improve all. Psychology and mental disorders work the same way. If you have one, there's generally 2 or 3 others that are related that can all be treated, but you got to treat the person as a whole. You got to treat all of them to fix all of them. Okay, so that idea of comorbidity is very important. Now, you've all used the big gray book, the DSM-4-TR, in determining your topic for your final project. That is the diagnostic manual for all mental disorders. If it's in there, you can be diagnosed with it. If it's not in there, you cannot be diagnosed with it. They come out with those new editions of those books. They change the disorders as new orders are discovered. They're talking about in the next one taking out the learning disorders because they're learning disorders, not necessarily mental health disorders, even though they can lead to mental health disorders. A child diagnosed with a learning disorder may be diagnosed with a behavior disorder because they're acting out of frustration. So while those learning disorders affect behavior and affect mental wellness, they might lead to depression, they might lead to aggression. The actual learning disorder itself is being debated as to whether or not that is a mental health disorder. So something to keep in mind. Now, how many of you have experienced anxiety? That's normal, right? Well, it can be a disorder, but remember those key points about disorder? Ongoing dysfunctional pattern, causes significant distress, considered deviant for the person's culture or society. Anxiety can become a disorder when it becomes an irrational, intense fear that interferes with somebody's daily life. Usually we hear them described as phobias. These are specific fears. Anxiety can be general and just cause an overall dysfunction. And there's not necessarily something specific the individual is afraid of, they're just overcome with fear. That would be more of a general anxiety, where a phobia is a very specific anxiety. It's fear of flying, fear of spiders. For a little fun, Google some phobias. I dare you to try to say them, but look at some of the things that you can actually be diagnosed as being afraid of. It's good for a laugh. Another common anxiety disorder that a lot of us hear about is OCD, or obsessive compulsive disorder. Now, most of us think of that as having to have the house nice and neat and the pictures hung just right and things like that. That's really not what it's about. It's not about being anal about how neat and organized your stuff is. OCD is actually a complex where they're afraid of someone breaking in, and so they have to lock and unlock the door 5 times before they can leave the house every day. That's OCD. Or they're paranoid about coming home, so they park their car 12 times in the same exact parking spot before they're able to get out of it. Things like that. That's OCD, where they have obsessions or compulsions, and they have to do those things to relieve the anxiety they're feeling in order for them to go on with their day.